we've done, you did local line?
Yeah.
Okay.
Do you feel that?
A little bit.
Feel sharp? Let's see how it goes. How's that?
Now,
Good?
did you pulled that rejuve out?
Yeah.
I was gonna put it back in. Put it. So.
All right, so we got the pilot hole. I'm putting in the broom. I'm gonna squeeze up a bit there. A little pressure. I'm going above the bone. I can't get it to go any further. It might be too low.
Let me see where you are.
Yeah, might be too low. You got it? Good.
Okay, so we need to just trim that a little bit.
Stuff it in or trim it?
Well, we're gonna trim it and then stuff it.
Yeah.
Because you just want to do the least amount possible.
There's a little
And
bit.
actually,
There's a little bit poking out. We trimmed it, and now we're stuffing it back in with the blunt.
and we're gonna put
cannula.
another one up in there, so that'll take it up further.
Okay, good. Good. All right, so we got that all the way up here, and it should be all the way in.
Yeah.
We'll just pull it out. That
All right,
one
there.
stayed.
And I think we could still maybe go another one or two going up there. So the consideration with him is if you put a trellis in, you could get too
little pressure
much
on it.
projection.
Just right on the tip.
So it's easier to, these are going to give you a little bit less than a trellis, and we can just stack several of these until we get the exact result we want. So,
Broom. Yeah.
Those are all unidirectional though.
There we go.
Okay. So I think just go straight in, and then it's a little bit. There's probably a pathway now, but at first it was a little bit tough. And then squeeze up. Squeeze up here. Cool. Got it buried to the hub, and then you can push down right up here, and then pull it out.
How do you know it's buried?
Don't twist.
Because what do you mean?
Just pull.
You can pull it. You can pull it. You can pull it. So this one we had
I
a
can
few
feel
out
the
there.
twist.
So we're going to cut those threads, and we're going to save the cannula, and then stuff it back in. So right at the skin, and then we'll see if we can stuff those back in.
Perfect. You've got a hump here now. That fixed that.
Yeah, there's much less of a ski jump. In fact, there isn't really one anymore.
And the nose
There is
isn't.
still some poking out, so we can
Is there?
try.
Yeah, just put, if you insert that, you'll probably bring some, you have to push it into that product.
Just poke it. Get the fiber and push it in.
You know, the problem with monos, or in this case, brooms, if you have anything protruding, you can't really distract that. You can't really put traction on that device and then cut it and think it's going to retract because it's just going to kind of pull out. Brooms, you might, because you've got 10, you might be able to get enough traction to where you can cut it and get the protruding part to retract, but it's just a little difficult. Exactly. Well, or yeah, and you can kind of stretch the nose up, cut it, and then when the nose goes back down, you know, so just be a little imaginative.
Okay, so did we
Worst
find...
case scenario, you have to pull it out.
You want to try one?
But
I don't know if we
Back-
need any more. What do you think?
well, so here's how I do this. I take a photo of the patient from the profile, and then I show them, and I always have the patient tell me when enough is enough. Okay, it's not my decision.
Alright.
Other than if I think we're going too far and this somehow it's detrimental to the patient, then I'll say, okay, I can't go any further. But you know, otherwise,
Okay.
You
you
have
know,
a picture
because
from
they
before
they
too,
can't
right?
see, they can't
Yeah.
see that. So
All right, so
if I
there's
ne-
you before.
Mm-hmm.
Okay. That's
Oh,
now.
wow.
Oh, wow.
Go back to the
I like that.
Oh,
Wow.
wow.
Can I see?
Oh, wow.
That was
That's
before.
Yeah. Mm-hmm.
So let's do this. Why don't you put one in?
He's okay putting more.
Yeah,
Okay.
so there's before, there's after.
Wow.
Yeah,
That's
perfect.
cool.
Let's put you put one in, and then we'll go stand on that wall and mimic the before pictures. With,
Okay, cool.
And then maybe by you putting in, you'll push the little thing in.
I think it's in.
Oh, we need another one.
He's good.
Have we already put 4 in?
He did my teardrop yesterday.
Which one I
We
did?
put 3?
Yes.
There should be a 4th one down here then.
It was really
Here.
good. He did it pretty good.
Mm-hmm.
Must have used it
Sometimes it
already.
depends on some people's hands.
Oh, here we go.
I'm telling you that doing that block really.
Did you know the broom or you got it?
We got it.
We found one laying on the floor, so
So the goal is we're going to go up over the nasal bone.
it's just Jeff.
So squeeze up on it, yeah, and then push.
Which one was it? Was that the,
Looks like she just needs a little massage.
I remember her, yeah.
Beautiful.
Very nice.
Pull. You can pull it.
Just pull.
Just pull it. Just pull it. All right, then we're going to cut those threads and then stuff them back in. Just cut it right at the skin.
Yeah, lift the nose up when you cut it, and that way it'll retract. in.
Good tip. Is there anything poking out now?
Nope.
Cool. One thing that's good about the epi is we can see the areas where he's anesthetized. We did the block anyway, but you can see like the whiteness there because of the vascular constriction. All right. So this vector is going to go like this. Actually, I got to
Did you
do
do
the
your
pilot hole
port?
first.
Okay.
Otherwise, it's
That'd
not going to
be
work.
interesting.
It's not going to work without that.
So because of where you are, I mean, and this is not just for your benefit, but everybody's, just pinch up, just pull your port area away from your vascular areas, right?
And don't go deep.
Yeah,
Just
you're
make the
not
hole.
going deep, you're just entering at a somewhat of an angle. Once you feel a lack of resistance, you should be done, that's it. You just want to get through the dermis. So the first 70 millimeters, 7 centimeters is a straight shot. Nothing about that is. Once you get to the curvature of the scalp, then it gets just a little bit more technically complex.
I'm just going to go as far as I can with it.
Okay.
If you drop it short, is that okay?
Yeah,
Or-
yeah.
Okay.
I mean, again, it's just magnitude of lift is
You
going to
okay?
be gauge,
I think
robustness
that's-
of the device, and
Probably
the amount that's in. So you lose a little bit,
So you can bend
but
it
I
over.
mean, it's
You wanna keep
not
it
that
over?
significant.
You bend it
Yeah.
over.
So I mean, the point of this technique is to demonstrate trying to get all of it in. You can put a little bit of digital pressure, and I mean, if all you can do is 90, okay, 9 centimeters is close to 10.
You
Rounds
okay?
up to 10.
Yeah.
So.
You are?
I'm fine.
Okay, good.
So you can see that the point is you can get around that curvature
These,
and you can have a very comfortable procedure.
yeah, these needles are really flexible.
Yeah. And so a combination of torquing and digital pressure will get you around significant curvatures.
Okay, coming out.
Okay.
It's a blot out. Did it fix higher?
No, it's just a really long one.
Okay.
So,
Yeah, no, I mean, they're just a very few barbs out.
yeah, so this is.
That's a nice, robust device
not
there.
About that
Yeah.
far.
Yeah, that's the forte.
Wow. A lot of lift.
Let's see.
Oh yeah, you can see already.
God, from
Huge.
one to the other one.
Get a photo of a
We can do this other one, too.
demonstrating that. Oh, you got that, huh? Geoff, can you sit up for us? Yeah, okay. For the camera.
Looks like you've had a stroke now.
You kind of see, you can see the angle here. This is a much more acute angle. This less so. The elevation, obviously, that's one device. So very good.
So I'm not going too deep so I don't hit anything. And I'm kind of just stretching it around to make it a little bigger hole.
Is that an 18 or a 16 gauge needle?
That's an 18. Yeah, that's better. Okay, so then I'm also like, now that I'm in, I'm going to see, okay, I want to make sure I'm in line with my vector. And I go a little deeper, I get in the plane, and then this one's going up really smoothly. And then it gets harder as we have to make that turn.
So the thin walls of our needles allow that turn to be made. Because while the thread is robust, the actual needle, they're very flexible.
So because it's bidirectional, do you not want to be pushing on it much when it's going up, or is that fine?
You don't want to be
Until
pulling
you
out,
engage
you
it.
don't want to pull back, you just want to keep going forward and out.
Yeah, bidirectional, right?
Mm-hmm. Okay, so that I can see that it's disappearing into the hub there, so I know that we're engaged.
Nice job. That's impressive.
Okay, so let's sit up.
Should we undo all the markings?
Looks good. Looks really good. Which one's that?
This is a 19100.
Would you want 20 or 19? We're using 19s?
I don't remember.
I thought they
What's
were
that one?
20s. This one's 20 by 90.
Okay, let's do those.
So they're tiny bit shorter.
And these are bidirectional?
Yeah.
Okay. Okay, yeah, I think that's good.
Yeah, the Fortes are thicker, they're a little bit harder. I
Yeah.
usually use a 16 gauge needle.
Really?
I mean, you can do it through 18, but it's just a little harder.
Even numbers help.
Oh, right. Is that your blood?
No, we got a counter.
Doing okay?
Mm-hmm.
Yeah, what do you think? Is it good blood? My God, that's a lot. You didn't paint by the end? Oh, I don't paint. So how long are you going to do this? You might need it to be on a table, like a steady
Well, I
surface.
don't know if it does or not.
Okay.
That's why.
Yeah.
Yeah. Oh, in fact, we can roll it.
But I don't have, it has to go further.
Getting there.
Yeah, yeah.
No, I think he wanted what they're putting in, what they're putting in.
Inventory for everything that he's used here.
You want me to keep track of what they're putting in?
Yes, please.
Mm-hmm.
And there's your kit, it's right there, the one that's wrapped in.
So I think you're up to the bend here, so we just got to like push down on that and then keep muscling it through. As long as you're able to tolerate it, Jeff.
Oh yeah, I'm fine.
I know I'm
You
in your
want to leave
face
one
here.
on him and just get one for that? How's that? Is one video and one's camera? What's going on?
And then I also like you can pull back on this tissue to
Oh,
help.
okay,
There's
to
no,
help.
there's no
Yeah.
particular rush other than,
Okay,
yeah.
that helps.
I'll let her finish up and then
All right.
I'll leave it here.
So we go.
Poke through. Okay, well that's a good complication to go through.
So this one got a little superficial?
That's fine.
Yeah.
It just exits.
Yeah. Yeah.
That's
we can actually
that's
pull up
how
on it
that's
more.
how you know you got the maximum in there when it starts exiting
Yeah, it's no
the
problem.
distal end. That's not the yeah. You would have had that anyhow if you would have started from the top and gone down. So
Exactly.
right.
Yeah.
And so what I do a lot of times is, you know, if you struggle like that, sometimes I'll put just a little bit of lidocaine to hydrodissect and to numb it, and then kind of punch through some fibrous tissue or whatever. And look, all you're struggling over 5 millimeters,
Okay.
right? So
So you got plenty of.
I think he's going to have lift. And what I do, so on this, what I'll typically, you know, I'll anchor here, and then once I get past around here, I'm really going to pull up, because you can always, you know, decrease your lift. And if you can Photoshop gloves in there, that'd be really good too. Yep. Yeah, we can we can unanchor some, and so I always go for maximum lift, and then I can decrease that. Once, you know, you can get a little bit more lift sometimes by massaging up and re-anchoring your device.
All right. Now we clean it up. I think it looks great.
So one thing I'd like to point out is you see these tracks?
Yeah.
That's not thread. This is edema, because you've got his skin is thick, but relatively your skin very thin, bony up underneath. So any kind of edema is going to just push out. That's expected. 5, 10, 15 minutes after you place a thread, typically you'll get that. If it's rapidly developing as you put it in, you're probably getting a little bit of edema, which should not happen often, if at all. So, who cares? We give the patient a mirror and we ask them what they think, and then
I keep taking pictures and showing it to him.
if he's
We need a
happy,
mirror.
if he's happy, well, you had to take the photo of the side profile.
Hard to say with all the.
Blood and
I'm fine.
fishing line and